Thank you for staying with us right here on BERNAMA. This is episode 11, season 3.0 of Medical Today with me, Jared Pratnam. We've got an awesome show coming your way. As always, we'll be talking about urological care for patients. We'll be having a Dr. Rajendran from KPJ Damansara Specialist Hospital. He'll be joining us shortly. We'll also be talking about disinfecting wounds with an antiseptic solution. We have a video on that for you. First aid mistakes, we call that. But for now, let's talk about supplements. I mean, the world over, we're spending billions with regards to supplements. All of us want to be in the pink of health at all times. And we know that by the food we eat, we don't get or derive much vitamins or minerals from it. So we need supplements. And to do that, we have with us Emily Chai, consultant pharmacist from Blackmores, Malaysia, to talk about supplements and what we need to know as Malaysians about supplements. Emily, welcome to the show. It's good to have you on the show. And this is one of my more interesting, or rather my topic of interest, simply because I love supplements and I love shopping at pharmacies all the time. So to start off the conversation, I'd like to talk about supplements. Why do we take it, or why must we take it?
Okay, thank you for having me. All right, firstly, why do we need supplements? Okay, firstly, it's for the nutrients, all right? And why do we need nutrients? Nutrients is basically food for our cells, all right? All our organs will need nutrients, right? So when we talk about nutrients, we are actually talking about vitamins, minerals, all right? And we are actually lacking of it, all right? Why? Because of the diet, all right, that we're taking, and also the lifestyle that we have, all right? When we are stressed, we tend to deplete in vitamins and minerals, certain vitamin and minerals. So we need to top up with that. So normally, where do we get nutrients? We get from the food, right? Yeah. But nowadays, what are the type of food that we're taking? Usually,
right,
fast food.
Fast food, chow fan.
Yes.
Yeah. Tai chow.
Correct.
Yeah.
A lot of carbs, and we're not taking enough vegetables and fruits.
Right.
And do you know how many types of fruits and vegetables are we supposed to take in a day? Minimum 5.
Minimum 5.
Yes, a day.
Right, right. It's also interesting you mentioned that, because when you look at the amounts of potassium we need on a daily level, I think the number of bananas we eat doesn't quite cut it.
Correct.
Yeah?
Definitely.
Yeah. So looking at that alone, we now understand that our body lacks the minerals and vitamins we need.
Correct,
yeah?
correct.
Yeah.
And at the same time, even if we do take, vegetable, fruits, enough of that, but sometimes how much of the nutrients are still in the crops? I mean, in the fruits and vegetables that we have. Nowadays there is a over cultivation of the crops. Then the soil, they don't really give it time to actually replace the nutrients. So the vegetables, the natural food that we have sometimes may not even have enough nutrients for us. And especially if we are living in a type of lifestyle, nowadays stressful lifestyle, we don't get enough sleep, we get stressed. It actually depletes the nutrients from our body.
I guess even if you're looking at vegetables and fruit, the way we cook them also is something we need to question ourselves about.
Yes, definitely.
How much nutrients are left in the food after they're cooked the way we like them to be. Yeah?
Yes, actually, ideally we should eat the vegetables raw, but not everybody can eat raw food, right? Yeah. So.
Right. So, which brings into question supplements. Now, with regards to supplements, there are a lot of rules to supplements and how you should take them. Now, there also is a recommendation for adults and young adults or young people who are getting very active or having an active lifestyle. Now, what health supplements would you recommend for young adults and senior citizens?
Okay, for young adults, normally their complaints would be tiredness, all right, stress, low immunity, all right, because they tend to, sleep less. The way they eat their food will be more, unhealthy. Yeah. So usually I would recommend a multivite. Okay,
Right.
firstly a multivite, all right, which actually covers all the most
So
of the vitamins.
when you say multivites,
Yep.
right, so this is something I really like very much. When you say multivites, there's just so many different ranges out there. Essentially, in a multivitamin, what are you looking for?
Usually multivite, most important is you contain all the main vitamins like A, B, C, D, E, K, all right, and the minerals. You will need zinc, magnesium, calcium, all right. Those are the basic one. Okay, when you talk about multivitamin, the nutrients, the strength in each of the vitamin and minerals, they are not high. Okay,
Right.
they are just just enough to cover the daily nutrient needs. All right. We call it nutritional insurance, meaning you're taking just in case you don't have enough.
Right.
All right, because we don't know, we can't check. Okay, I don't have enough certain vitamins, so you take that just in case you don't have enough of certain vitamins and minerals.
So
right
now they do, and I'm digressing here. Sorry
Yep.
about this, but they say that you need to do a baseline test about your levels of minerals and vitamins. Do people actually do that before they go out and buy supplements these days?
I mean, it's not common to do it.
Not common here.
Yeah, not common here, and also it's additional expenses. Like me, we were to do it. Normally, people don't do that.
Right.
Yeah, so we usually just take a multivite because it's just basically
So it's a
cover your
general insurance.
Correct. Most
yeah.
people can take, yes. Like how you buy insurance, right? So
Right.
you just in case
Okay.
you don't have,
So when
just enough.
they say a lot of people put emphasis, or a lot of doctors and people in the medical industry put a lot of emphasis on fish oil. Now,
Correct.
at what age do you start taking fish oil?
Okay, usually fish oil, to be honest, you can actually start from young because children can take fish oil. And in fact, pregnant mothers should already be taking fish oil already because the baby, they need to develop their brain and their
Right.
eyes, and fish oil contain the DHA, which actually nourishes the eyes and the brain. So actually from the womb, you already need to take, So, and you can take, from children, school going children, teenagers, they should take because they are, studying in college or uni, and they do need that extra DHA for their memory, to memorize their exams or whatever.
Right.
And definitely the adults, the young adults and also the elderly, because for their heart.
Right. So for cardiovascular reasons,
Correct.
you need to always supplement with fish oil. Yeah?
Correct.
Now, they for the senior citizens, it's usually recommended that they have something for their joints.
Correct.
They also talk about CoQ10. But when you look at glucosamine and chondroitin, a little something we use for joint aches all the time.
Yep.
Some people cannot tolerate chondroitin and glucosamine simply because it gives them a heartburn.
Oh,
yeah,
right.
So how do you go around that?
Usually we recommend to take after food.
After food.
Correct,
Yeah.
because there are some, like you said, there are some people who actually cannot tolerate, taking glucosamine before food. I can't tolerate taking glucosamine before food. I'll get like a gastric.
Gastric.
So I usually just take it after, and there is actually no difference between taking before or after meal. Yeah, in terms of the efficacy, it's the same.
Right.
Yeah, so just take it after.
Another very interesting thing that people always talk about now is CoQ10.
Yep.
Yeah, it started off about 10 to 12 years ago. It started gaining some traction, but today they say, especially if you're on statins, you're on cholesterol medicine,
Correct.
you should supplement that with a CoQ10. Now,
Yes.
with CoQ10, there's ubiquinol and ubiquinol.
Yes.
Okay, how do we differentiate what's good for us?
Okay, firstly, maybe I'll just explain a little bit about why we need CoQ10. Basically, CoQ10 is a type of enzyme, all right, which actually nourishes our cells. Okay, so each of our organs will have cells, right? So we need CoQ10 to nourish all our organs, all right? And definitely we need a CoQ10 for our heart because our heart never stops pumping, all right? It never stops working. And we do need, it will need more CoQ10 compared to all the other organs.
Right.
That is why people always associate CoQ10 with heart, with the heart health. All right, and your question about ubiquinol and ubiquinol.
Right.
All right, I know they're in the market. People do sell the ubiquinol form. All right, which they say that it is the active form. Yes, that's right. But actually, our body is able to convert the ubiquinol to become ubiquinol.
Right.
All right, our body is capable of doing it. So it's just that it's up to you. I mean, if you want to take the ubiquinol, it's fine. It's just that it's a bit more pricey. All right, but in the end, if you take the ubiquinol, which is the initial form, your body will convert it.
Right.
Your body will convert.
Right.
Yeah, it will still work. Yes.
So from there, let's move into two very important demographics: women.
Yep.
And children.
Yep.
Now, for pregnant women or women who are going through menopause, what would be the go-to standard for them with regards to supplementing?
Okay, firstly, I will go to talk about pregnancy. All right. So pregnancy, the first thing that you must remember is folic acid. It is extremely important.
Folic acid.
Correct. Because a lot of people don't know that folic acid you should take at least 3 months before you conceive. All right. Yes, a lot of people they thought that folic acid is to increase the chance of them getting pregnant, but actually it's not. It's actually to prevent what we call a spinal condition, what we call spina bifida, which is actually a debilitating disease. All right, and they have it for life. They need to go for surgery if they have this condition, and we do have cases where people actually do, their children get that. The babies, are born with spina bifida, and they regret for not taking folic acid during that, when they are supposed to. Yeah.
So it's folic acid and iodine.
Iodine is for the brain. Yeah.
Now, with folic acid, how much do you take? What would be the a decent dose or recommended dose?
Okay, minimum is 400 mcg. All right, but for someone who has high risk, like say you have family member who has spina bifida before, or maybe you have miscarriage, history of miscarriage, usually we will recommend 5 mg. So it's much more.
So there's also things that women need to take into consideration would be calcium, EPO, and BioE. These things are also very important. What is your advice on this?
Okay, for menopausal women or premenopausal women, usually we recommend them to take calcium. Calcium is extremely important. Why? Because as a woman reach menopause age, all right, which is about 50, usually the estrogen level will drop.
Right.
Okay, and usually the calcium would deplete from the bones, and therefore you see most of the time women who actually, when they go and test their bone density and all that, they actually have very poor low density bone, all right, which actually causes osteoporosis.
Right.
Yeah. So and there is a risk of fracture. And we don't want them to get the fracture, because usually when they get a fracture, they don't last. They cannot survive very long.
So hence why your calcium intake is very important.
Correct.
And at this point, the recommended dose would be?
Usually, we will recommend
as a rule
at
of thumb,
least 1,000 mg for most people and most adults.
Right.
For menopausal women, we will recommend 1,200 mg.
So is it just calcium, or should calcium be coupled with something else for proper absorption?
Vitamin D. Definitely you need vitamin D. All right. Vitamin D is the one, it's like, imagine yourself, you have a wall.
Right.
Okay, you have the bricks. Okay, the bricks are your calcium.
Right.
Okay. And vitamin D is like your cement, the one that holds the bricks together.
Right.
So now, you need both.
You need both
to keep it strong.
Right. So very quickly, for children, what do you recommend for children when it comes to looking for supplements for your young ones? There are so many nice looking ones out there. What do you buy?
Yes. I feel tempted to eat them as well. Okay. Usually, children, they're very picky eaters.
Yep.
Children tend to like, they don't like vegetables and fruits. They want just white stuff, fries, rice, bread. So they're not getting enough nutrients. So I would definitely recommend a multivitamin and minerals, all right, which is combined.
Something chewy lah.
For kids. Definitely they need something that can chew. But I want to highlight that there are a lot in the market which are actually loaded with sugar.
Right.
Yes. Correct. It tastes good, but the thing is you are feeding your children with all this sugar, so you need to really be careful. And try to look for something which has, which doesn't have the preservatives, artificial sweeteners, colorings. Try to look for that kind of supplements. If possible.
Now, the other thing that people always talk about when they buy supplements is its efficacy and how long it will take for it to start working. Now, generally, when you buy a supplement or when you start taking a supplement, how long does it take for you to see some decent effects?
Oh, right. Okay. So for supplements, usually people will associate it as for long term, right? I mean, actually, it's supposed to be taken for long term, and it's like for prevention. But actually, there are some supplements which actually can be used for what we call treatment. All right. So, for example, magnesium. All right, magnesium can be used for things like migraine.
Right. So you want to relax your muscles.
Correct.
You want to go to sleep.
Go to sleep, have a better rest.
But here's the thing: with too much magnesium, it might cause you a bit of diarrheal problems.
Oh, you're good.
Yeah.
All right.
I'm just off the top of my head, yeah.
Yes, you're
right.
But
I tried all this.
You're right. Okay, but it's only above a certain amount, all right? And usually people won't take. It's like maybe 9 tablets a day,
right,
which usually people will not take that amount. Yeah, so not to worry about it. If you really do experience any diarrhea whatsoever, just stop it or cut down the dose. The diarrhea will stop.
Right.
No problem.
But here's some questions that came in, via people who've sent it in through our email. And one of the questions that came across, which is very important, I think, is if you have a whole hand of supplements, can you take them all together? Is there a proper way of taking supplements, like a proper time for taking a different set of supplements?
Okay, usually recommended, as I mentioned earlier, after food is the best time to take your supplements, all right? And I believe, yes, there are a lot of people who take a lot at one go. So, okay, general rule of thumb, it is okay to take them together, but there are a few minerals which we don't recommend to take them together.
For example?
Okay, usually they are like zinc, magnesium, calcium, okay, because they tend to interact with each other, like they kind of block the absorption of each other, but usually when it's only taken at high strength. Right. All right, if you're not sure, you can just split them apart 2 hours, just to be safe.
Right.
Yep.
So the other problem is taking your medications with your supplements. Now, a lot of people are afraid, especially with Dr. Google teaching you so much these days.
Yes.
You've got your supplements in one hand and you've got meds in the other hand. Hypertensive, cardiovascular drugs. You have your NCDs, drugs for your NCDs, say for your diabetes mellitus. What do you take first? What goes first? Yeah.
All right.
Because people are afraid of interactions.
Correct. Yes. All right. A general rule of thumb, we would usually recommend you to take 2 hours apart. Meaning your supplements and your medication, split it 2 hours apart. That's the general rule of thumb. But I mean, there are certain supplements which we do recommend them to be taken together. Okay, for example, people who take high blood pressure medication, they actually should take fish oil as well, right? Because fish oil actually helps to make the, balance the blood pressure actually.
So when you say hypertension medicine, you're talking about ACE inhibitors, anything ARBs, anything at all, the general rule is the same thing?
Yes, correct.
Right.
Yep. So
what about people with on warfarin or blood thinning medicines? Okay.
Yeah.
So there's clopidogrel, there's aspirin.
Correct.
There's a few others out there which are new in the market.
Yep.
So these things are very important. And the fear of interaction or bleeding gums, these things are something that people worry about too.
Yeah. Okay, for this kind of, people who are taking, blood thinning medications, mainly their concern is bleeding. Okay, so there are studies to show that basically it's only when you take fish oil at above a certain amount, all right, very high strength, that it may cause bleeding.
Right.
Only if you take above a certain amount. If you're taking the normal dosing, like let's say the 1000 mg fish oil, you're taking like 2 or 3 or even 4 capsules a day. That's fine. There is no. It won't cause bleeding issues. It's only if you take above. A good example would be 10 capsules a day.
Right.
Let's say if you take more than 10 capsules a day, the risk of bleeding will be higher.
Right.
But if you take anything below that, it is still fine. Yes.
We've got about 2 minutes left on the show. Time flies really quickly now.
I'm enjoying myself.
Yeah. So now, if I want information, where do I go to seek information about health supplements? And before we close, what would be your closing statement to all of us being a specialist in this field?
Okay. Firstly, for for everyone who wants to take supplements and you're not sure about the dosing, you're not sure about the interactions, what you can do is you can actually go to what we call pharmacists, okay, to actually consult them. Okay, we have trained a group of pharmacists. We have an institute, all right, we actually train pharmacists, a special professional training, okay, on health supplements, all right, and they actually are able to give you proper consultation on whether there's any interaction, whether what is the correct dosing to have the proper results, all right. So they are called CMED accredited pharmacists, which you can actually
CMED accredited pharmacists.
Correct,
right.
And you can actually see we have trained over 700 pharmacists, all right, all over Malaysia, all right, with this course, this program, and they are located in different type of pharmacies. So we have a list of their pharmacies locations,
right,
and it's found in the Blackmores website, Blackmores Malaysia website.
Right. So all you need to do is go to the Blackmores Malaysia website and you'll get all the information you need.
Yes.
Very quickly, we've got 40 seconds left. Your message to Malaysia.
Okay, most important, remember, take your supplements at the right dosing. Okay, that's very, very important because a lot of people take supplements and they're taking at the wrong dose. They're just taking 1 capsule, 2 capsule. Actually, it doesn't even work.
Right.
So yeah, that's why they don't see results. So make sure the dosing is correct. Okay, and if you're unsure, remember, go back to see your pharmacist.
If you're unsure, I think that's the most important advice. Go back to see your pharmacist. On that note, we'd like to thank Emily Chai, consultant pharmacist from Blackmores Malaysia, joining us right here on Medical Today. Emily, it was a pleasure and an honor having you in the studio. Thank you.
Thank you.
Thank you so much. Stay with us. We're going to take a short break and we'll be back with more right here on Medical Today.
Do you experience indigestion, bloating, or stomach upsets? You need Blackmores Digestive Enzymes Plus. Made from natural enzymes and ginger, it helps to break down your food so all the nutrients can be absorbed by your body. Healthy tummy, happy you.
Hello and welcome back to Medical Today with me, Gerard Ratnam. We just spoke about supplements a while ago and how important it is to make sure you have good levels at all times. From there, we move into urology and we're going to be talking about urological care for patients. Now, urology is a surgical specialty that apparently deals with the treatment of conditions that involve the male and the female urinary tract and the male reproductive organs. Now, joining me in the studio is Dr. Rajendran Sundaralingam. He's a consultant urologist and a urological surgeon from KPJ Damansara Specialist Hospital to give us an insight as to what he does. Now, my first question to you is about spinal cord injury. We were meant to talk about urology and urological problems, but we're talking about spinal cord.
Yes, thanks, Gerard. Now, it's quite interesting, many people don't realize what's the relationship between spinal cord and something down there. But in fact, spinal cord actually is a relay system from the brains and actually controls many other things. It controls your bowel, it controls your bladder, it controls your movements of your body, it controls many other things. And many people don't realize that once you have a spinal cord injury, it takes over the function, it removes the function of other organs. And one of the organs that is affected is bladder. And if one does not look after the bladder well after spinal cord injury, they can actually succumb to kidney failures as well, because the bladder may get very distended, kidney may get very swollen, and this is very important morbidity and mortality for as far as spinal cord injuries are concerned.
So before we get into conversation, my second question to you would be to tell the difference between a paraplegic, a quadriplegic and a tetraplegic, just so we know what we're talking about.
A paraplegic is somebody who cannot move both the lower limbs of the body. That means both the legs is completely paralyzed. It can either be paraplegia when it's completely paralyzed or paraparesis when there's weakness of the limbs. Now, tetra and quadri are the same thing. It means 4. So tetraplegia and quadriplegia is the same term. That means you cannot move both your upper limbs and lower limbs. I mean, the legs, hands cannot move at all. Then we call the person as the condition as tetraplegia or quadriplegia. And when there's weakness, we consider it as tetraparesis or quadriparesis.
Right.
So basically they're actually the same terms.
Right. So now with all these problems, we know that people with spinal injuries or spinal cord injuries will suffer from some kind of urological problems. What are the main problems you see, or what are the main causes or symptoms that present themselves when someone is become a quadriplegic, a paraplegic or tetraplegic?
See, once when the spinal cord injury has occurred, they actually go into what's known as a spinal shock. There are about 3 to 4 stages of a spinal shock. They become completely paralyzed, lose all their reflexes. And then after a few weeks, they gain back the reflexes. Then only we can determine how bad this paralysis is, whether it's due to a complete spinal cord injury or is due to an incomplete spinal cord injury. Now, it's very important to determine this. So what the spinal surgeon or orthopedic surgeon does is they actually evaluate the patient, assess the patient that time itself, and determine by what is known as the ASIA or Asia grading system. It's determined as Asia A, B, C, D or EE, which is normal.
A, B, C, D or double E?
Or E alone.
Okay.
Now, based on that, they will know whether this patient has got, they have to determine whether this is a complete spinal cord injury or an incomplete spinal cord injury. But incomplete spinal cord injury, they can present in different ways. They can present as a sensory loss, a motor loss, the extent of the motor loss, and so forth.
Right.
Now, the odd thing about the bladder is, you see, when we talk about the bladder, when the person wants to pass urine, there are so many other functions that we need to talk about. Whether the bladder has to be normal and the sphincter which controls the urine has to be normal. Normally, when an individual wants to pass urine, the bladder has to contract, the sphincter has to relax.
The bladder has to contract and the sphincter has to relax.
Okay. After passing urine, they have to hold the bladder. The bladder has to be relaxed, the sphincter has to be contracted. Now, anything other than this is already a disorder of the bladder. So, the disorder of the bladder can either be an uncontrolled contraction of the bladder or a completely relaxed bladder. At the same time, an uncontrolled contraction of the sphincter and a completely relaxed sphincter. With this, you can have different permutation and combinations. A completely contractible bladder with a contractible sphincter as well, or a contractible bladder with totally relaxed sphincter, or a relaxed bladder with totally contracted sphincter, or a relaxed bladder totally contracted, totally relaxed sphincter.
It's very confusing, but
yes,
yeah, that's a lot of information there.
In fact, we use this term synergy, where when there's contraction of the bladder, the sphincter has to relax. When the
so it has to work in concert.
Yeah, it has to work in what's known as synergy. Now, we have to determine, in these cases with spinal cord injuries, we have to determine whether this patient has got a problem with the bladder and the sphincter. And what is the relationship, and what type of bladder and sphincter problem we are dealing with. So we have to actually assess, go through the history, go through the examination. We do some X-rays or CT scans or MRIs.
Right. But I guess if you're dealing with someone who has a spinal cord injury, it's either an overactive bladder or an underactive bladder.
Yes. It's either an overactive bladder or underactive bladder, but it's not as simple as that. You can have an overactive bladder with overactive sphincter, overactive bladder with underactive sphincter.
Right, so the technicalities can vary quite a bit.
Why I'm saying this is because when we assess the patients, it's not only just thinking of whether it's overactive or underactive. We have to ensure that we are dealing it properly, so because the treatment will differ. So finally what we do is we do what is known as a urodynamic test, where we use pressure catheters into the rectum and into the bladder. Then we determine the function of the bladder.
Pressure catheters are put through the rectum and the bladder.
Yes.
And how does it work then?
And then we fill up the bladder with some saline solution. We see the activity of the bladder. Based on the activity of the bladder, we can see pressure movements. Normally when we fill up the bladder, it should be known as a stable bladder. In other words, there's no pressure rise. There's hardly any pressure rise. The bladder expands well. When there's overactivity, the bladder suddenly becomes very unstable. The pressure starts rising. The pressure starts oscillating. It starts fluctuating.
Right.
Okay, and then we know there's something wrong with the bladder. At the same time, we put EMG, which is known as electromagnetic electrodes, or surface electrodes over the bottom area,
Right.
and we can see the sphincter activity as well.
So you're using surface electrodes.
Yes,
Okay.
yes. And then we can know the relationship. There are two phases. One is a filling phase, where we fill the bladder with saline. We see the reaction of the bladder and the sphincter. And then is a voiding phase or passing urine phase, where the individual passes urine while the catheters are still in place.
Right.
And then we'll determine whether it's a very high pressure bladder or low pressure bladder, and whether the sphincter takes it or not.
Right.
So because of this, we can have different presentations of bladder. The person can have a very overactive bladder, always rushing and passing in urine, or they can go into retention. Then the bladder is very full. Very distended.
And that can back up into the kidney.
Yes, that can back up in the kidneys. And then they can also present with a very full bladder, but when they cough, suddenly all the urine comes out because the sphincter is not working
Right.
well.
So that would be incontinence, yeah?
Yes, incontinence, which is leaking of the urine.
Right. So these symptoms can present itself in someone with spinal cord injury. But let's talk about the normal person who starts having, say, incontinence. I think that would be a problem for seniors, or some of us, with bad luck, we get it in our 40s and early 50s.
Yeah.
What can be done about this?
Okay, so basically when you have incontinence, it's actually leaking of urine. It may be a simple topic, but actually there's so much more details in it. When a person leaks, we need to...
It's also embarrassing,
Yes, it's also embarrassing, and many patients will not come and meet us for it. They will try to use pad or Pampers or something like that. But it's very important that for us to know that the longer we live, we need to live with a quality of life. It's not just a quantity alone. So these people who leak, they can leak due to various causes. They can leak due to a bladder which is too overactive. So before they can reach the toilet, before they can open up the door, suddenly the urine comes out. Or they have to quickly rush in. Okay, let's say for example they are on the road, on the highway, they can't reach the restroom, they have to stop by the side of the road and just pass urine. So that is due to too much of overactive for the bladder, and the urine comes out. Sometimes there can be a retention due to prostate compression or prostate enlargement.
Oh, let's not go there yet, because I want to come to that topic very, very soon.
Yeah,
something. There's a few misconceptions with regards to that.
There is.
We'll come to that. So sometimes it's related to that.
Yeah. So that is known as overflow incontinence. Same thing like a glass of water.
Right.
You pour in a water, it's too much overflow, it starts leaking out. So same thing, sometimes you can get an over distended bladder. The bladder is too full with urine, and it just invariably just comes out. That's known as overflow incontinence.
Right.
Then we have such thing known as stress incontinence. A person is normal, the bladder is completely normal, but the sphincter which controls the urine is a bit weak. So the person coughs, and suddenly the urine comes out. That's known as stress incontinence.
And this presents itself a lot, from what we understand, and from what I read, a lot of women have
Yes, a lot of women, especially in multiple pregnancies, or if there's an obstetrical injury. Let's say they're doing some procedure or something like that, and there's some amount of injury, then they can present with stress incontinence. Some of these spinal cord injuries which affect the sphincter can also present with the same thing. So when they cough, they suddenly come out.
Right.
Now there's another thing known as functional incontinence, very important. It's not mainly due to a bladder or sphincter problem, but it's due to an elderly who cannot reach the toilet in time. Let's say you're now full bladder. You can always walk fast to the washroom, right? In an elderly person with so much of osteoarthritis, they cannot reach the toilet and suddenly the urine comes out.
Right.
This is not bladder or sphincter problem. It's due to the condition of the elderly person in reaching the toilet in time.
It's interesting that all these stories are making me want to go to the restroom now.
Oh yes,
for some reason.
So with me as well. Now that means you have overactive bladder.
Okay, so the third one was functional incontinence.
Yes.
So with all these bad stories you've given us, is there a light at the end of the tunnel for
Yes,
people?
there's always a light at the end of the tunnel as far as urology is concerned.
This is really okay. I like the fun in it, but okay. So what can you do treatment wise?
Okay, treatment wise. Okay, first we have to determine what we're dealing with, and very important to know it's a bothersome score of the person. Let's say, for example, we have a normal individual. Retired, 65 years old man, retired, you're just sitting in the house doing nothing with your grandchildren. You have to pass urine 1.5 hours. Everyone, you have a washroom by your side. You just go to the washroom and just pass urine, and then watch and drink your coffee and watch a movie or something like that.
Right.
But if you're a CEO or managing director, you have to attend long meetings, you're in parliament or something, you cannot expect to just walk away every 1 hour, 1.5 hours to this thing. So that is known as a bothersome score. It has to be bothersome enough. So when you deal with overactive bladder, you have to decide whether that individual has got bothersome symptoms or not.
Right.
Then they can pass urine quite often, but it's not bothersome, it doesn't need treatment.
Right. If it's bothersome, then you look into the different modalities available. Yeah.
Now, it's very important to know this. Overactive bladder is not a disease or a disorder. It's a symptom complex. Tuberculosis is a disease. Malaria is a disease. But overactive bladder, the term has been coined for such symptoms which is bothersome, indicative for us, so that we can start treating them. Okay.
But we've also misconstrued it as a disease.
And I always speak to my patient, because once when they read the internet and they see, oh, they're passing urine more than 8 times a day, they get very panicky. But this is a qualitative disease, not a quantitative disease. Quantitative disease means like you have a cardiovascular problem, a heart problem, or stroke, or something like that. Your length that you can live is very much less. But this is a qualitative disease. You still live to the same age, but you want to make sure you live with quality. Now, when it comes to overactive bladder, once we have diagnosed overactive bladder, very important, overactive bladder is a very specific term to denote any bladder overactivity with no known cause. In other words, you have a tumor, it's not known as overactive bladder. If a tumor means it's a tumor with excessive bladder activity or stone, they can present with a
tumor with an excessive bladder activity.
Yes. So overactive bladder is a diagnosis of exclusion. You have to first exclude everything. The person cannot have blood in the urine, the person cannot have stones, the person cannot have infection. Some patients present with infection and they have this bladder overactivity, but this is not known as OAB or overactive bladder. So we have to rule that out.
So when you say infection, does it also mean the urinary tract?
Yes, urinary tract infection.
Right.
So once we have already established this diagnosis of overactive bladder, then we have got treatment. It's known as antimuscarinics or anticholinergics. They work quite well.
Right.
We start them on a tablet. It's once a night, and then we assess and see whether the symptoms have improved. If it doesn't improve, we can top it up. Top it up to a higher dose, or we can add in another medication known as beta-3 agonist, which is actually known as mirabraglon.
Right, a beta-3 antagonist.
Only if they don't work, then we have got intervention in urology. You'll be surprised what intervention we use. We use Botox injections into the bladder.
Right. It sounds very painful, but I'm sure you have a handle on this.
Many people will think that when we inject some Botox in the bladder, we're going to make the bladder more cosmetically more
but we all know it's to strengthen.
Actually to relax the bladder. So bladder is overactive. Some people do the Botox injection.
So you can't actually go on a date and say, hey, take a look at my bladder.
Okay. So you see, same thing as you're removing the wrinkles, right? You're going to remove the so-called wrinkles of the bladder. Okay, so you're going to make the bladder very relaxed. But that's only temporary. It lasts only 9 months.
9 months.
But these are for patients who are refractory or where the medication has not worked.
Right.
But there are some cases where even injection of botulinum may not work. Then you need surgical. You need something to do with surgery or something like that.
Right.
Sometimes it's spinal cord injuries. So there are times when we have to place in what is known as electrical nerve stimulation. We can use electrodes in the leg, or we can use even Sosial electrodes, or sometimes we have to put in a needle in the sacrum at the back, and we can use what is known as sacral neuromodulation. Now there was a time about more than a decade ago where these things were not available, so we used to do surgery. We used to augment the bladder. That means the bladder, we used to split the bladder open, take out part of the intestine, put over the bladder, and make the bladder
This is an augmentation.
Yes, augmentation of the bladder. But usually, in most cases, I would say about 18 to 90% of the cases, the medications now will work. But there may be some side effects, constipation and dryness of the throat. And there's certain contraindications. That means you don't use it for patients who has glaucoma or high pressure in the eyeballs. Then we don't use antimuscarinics for overactive bladder.
So what's an artificial sphincter for?
Okay. See, there's some cases where the sphincter is completely incompetent, or
it can't contract.
It can't contract. So in these type of people, they have leaking 24 hours a day, irrespective of whether you cough, irrespective of whether you sneeze, even you're sitting down or lying down, it just leaks out. Now these are the type of cases whereas usually seen in certain prosthetic operations for prostate cancer or certain spinal injuries where it only involves the sphincter alone. If that's the case, we put in an instrument.
Right.
We put in an instrument into the bladder, neck and the urethra, where it's something like a cuff. And then with the instrument, we have got a balloon, which is a reservoir, and a pump.
Right.
And the pump, we place it near the scrotum. And whenever the patient wants to pass urine, all he has to do is press the pump.
Right.
And it releases the cuff, which holds the sphincter, and they will be able to pass urine.
Right. So is it a simple procedure?
It's not a simple procedure, but it's a reliable procedure.
Reliable procedure,
yeah.
which means after the procedure, how long does it take for one to convalesce and be able to get back to normal?
Within 4 to 6 weeks.
4 to 6 weeks,
yes.
and you're back to normal.
Yeah, you're back to normal, but you have to always use the pump to pass urine.
Right. I want to get into something now before I get into what I want to talk about. I want to get into something now that we like talking about a lot. Kidney stones. Malaysians, we love our kidney stones.
Okay.
Yeah, and I'm sure you have people who come and give you theories about kidney stones.
Yeah.
Too much heat, so on and so forth. Yeah. So tell us about kidney stones and what do we need to know about kidney stones?
Okay, that's very.
Even before the show, I got him to check me.
No, it's very important, very interesting to know.
Yeah.
We are in the endemic stone belt for urinary stone formation.
Oh wow!
There's a belt which is known as endemic stone belt, which starts off from the Middle East, right up to Myanmar, India, Malaysia, Singapore, Thailand, Philippines, and all.
Would you say it's a Malaysia Boleh moment?
In these regions, the stone rates, urinary stone rates are very, very high. Why? It's probably maybe because it's a tropical country, you sweat a lot, you don't drink enough water, maybe your diet is different. When I went overseas, I went to Bristol for training in urology. We used to do 1 stone case a week. There's a particular Tuesday that we use stone cases. But when I'm
Tuesday
in Malaysia,
was stone day.
Yeah, Tuesday was a stone day. not where people get stoned.
Okay.
But in Malaysia, every single day when I was in government hospital, we used to do 10 to 12 stone cases a day.
Okay.
So that's how different it is. Now, this stone formation now is very important. If a patient was to ask me, okay, doctor, how do you prevent stones? Now I will have to explain why stone occurs. Then that's how you prevent stones. Same thing like a car accident. How do you prevent a car? You must need to know how it occurs. So okay, you have to wear a crash helmet or seat belt or airbag or ABS or something like that. So let's say you have a glass of water. You put in a lot of salt inside. You can get concentrated. You put more, you can get saturated. Then you can get super saturated. Once the glass of water is super saturated, no matter how much of salt you put inside, the crystals will form, aggregate and form back the salt. And that's what's exactly occurring in the patients with who has a urinary stone formation. Their urine is super saturated with uric acid crystals, calcium crystals, oxalate crystals, phosphate crystals and so forth. So the most important medication is
water.
Add in more water. So I always advise them to drink at least 2.5 to 3 liters of water a day.
Okay, here's the other thing now. This drinking of water. I know someone who drinks 5 large bottles of water a day. Now there's also a concern that people may overdrink water, and a lot of people don't read about this.
Yes.
And I'm sure you can give us some insights on this. Over drinking water. When do we stop drinking water?
Okay, that's what I actually advise my patients, because once I tell them, some of the patients come in very giddy and tell me that they are passing urine every few minutes. Now, over drinking water is a very, very important thing we never do. That's why there are few water drinking competition overseas where an individual can even pass away or can die or so.
Wow.
Because they drink too much of water, the whole brain gets swollen.
Yeah.
And when you drink water, the sodium levels are certain constant in the body. When you drink too much water, you're diluting the sodium. Once you dilute the sodium, the nerves get more irritable. They can get fits and convulsions. They first will start having headaches, then they start having visual disturbances, and then start having fits and all that.
Right.
So for me, I will always advise an individual to drink at least maybe 2 to 2.5 liters of water a day. If you're a stone former, 2.5 to 3 liters water a day.
You've got some friends who are so proud of the amount of water they drink. They even brag to I go to the bathroom like 9 times a day, and it's like glass. It's that clear. Yeah, I'm sure you have friends who tell you that, and they're very proud of it. For some reason, I think sometimes we're doing it wrong. So if you're going to the bathroom too many times a day, you're overdoing it.
Yes. What I would tell my patients is, see, there are 2 different ways to know how much to drink. Or 3 different ways. Number 1, calculating at least 2.5 liters of water a day. Or number 2, if you're thirsty, you drink water. And when you go to the gym or you sweat a lot, you drink water. And number 3 is checking the color of the urine. The color of the urine cannot be orange or cannot be dark colored. Very mild yellowish color or clear color is just nice.
Okay, but if you wake up in the morning and it's dark colored?
If you wake up in dark color, means you're not drinking enough water the day previously.
Prior to that?
Yeah.
Okay, so you have to make sure that it's not...
You have to drink adequate amount of water, but not excessive. Anything over excessive is not good.
Anything excessive is not good. So I hope that's advice for all of us. Now moving into something I want to talk about. People talk about an enlarged prostate. So apparently this term is wrong. Why is that?
This term is actually inaccurate. It may not necessarily be wrong. See, prostate enlargement, when we use the term for the layman people, because they do not understand what prostate compression is all about. See, we know very well where is the prostate at. The bladder is here. The prostate is just below the bladder. Now you have an enlarged prostate. You have a prostate very, very enlarged, but it doesn't compress the urinary passage. You will not have any symptoms. Prostate enlargement is just an anatomical term.
Right.
Just how big a prostate is.
Enlargement in and of itself is not the problem, but it's the compression that it's causing.
Yes. Right. So centrifugal enlargement is not a clinical problem. Centripetal compression is. So when they compress the bladder becomes very stressed. So the person passes urine very often, and you have a very slow flow of the urine.
Right.
And some more, this prostate, that's why we call this as BPH, or benign prostatic hyperplasia. But there was a time when the urologist wanted to change the term, because many people are using the term prostate enlargement. So we wanted to change the term to BPO, or benign prostatic obstruction, to denote the term. But even then, when you have the symptoms, again, like overactive bladder is also a qualitative disease. It depends on the bothersome score. But it's very important. One of the first sign or symptom that one has with this prostate compression or BPH is getting up in the night to pass urine.
Right.
At one time, we classified that significant symptom as getting up to pass urine is known as nocturia of more than 2 times in the night.
Right.
But now we recognize that even getting up once in the night is also not good, because you cannot break your sleep.
Right.
There's such thing known as obstructive sleep apnea and sleep fragmentation and so forth.
How then do you hydrate yourself enough to not be able to experience nocturia?
In a normal person, even you hydrate yourself enough, they will not get up in the night.
Say if you take a full glass of water before going to bed.
You're not supposed to do that.
Not supposed to. See,
so
we learned something.
Don't overdrink. Yeah. So you want to finish the 2.5 liters of water a day. Try to drink in the daytime, or maybe in the evening, or maybe later in the night, but not just before you sleep.
Right. Okay. Here's some of the frequently asked questions for Malaysians. Okay, we say like when something is wrong, they say your body is heaty, urine's dark, go drink barley.
Okay. Barley, the advantage of barley is no different from the advantage of water alone.
Okay.
There's only
there we have it.
There's only one thing that has made a difference. Only one solution containing citrate. So citrus fruits, that means orange, lime juice, lemon juice, lemon nipis and all that. That's the only thing has been shown to reduce stone formation. Why? Because the citrate prevents aggregation of the crystals.
Right.
So if you ever ask for an advantage, it's not apple green ciders or not barley water.
Right. So this whole apple cider thing is a myth? Would you safely say it's a myth?
I wouldn't safely say it's a myth, but it's been propagated so much. You know why I will not, because there's no proper trials. And number 2 is apple. If you really go through the content of apple and grape, it has oxalate. Right. And oxalate can form stones. So the apple green cider thing, although it's all over the internet and all that, is not very specific.
Right.
It's not been proven to prevent stones.
Right. So you would be a proponent for putting a slice of lime in your glass of water.
If
or
I'm a
lemon.
stone farmer. If I'm a stone farmer.
Yeah, okay, if you're a stone farmer.
Yes,
Or
yes.
not just plain water
Yeah,
will
not
do.
plain water will do.
We've got
Yeah.
about 1 minute left. Your
Yeah.
message to Malaysia with regards to urinary tract health. And that's the camera. So maybe let's talk to all of us.
Okay. Urinary tract health, you need to drink adequate amounts of water. Don't overdrink. 2.5 liters of water is just nice. You have any urinary symptoms, getting up in the night to pass urine or poor flow, please see the doctor, because even though it's a qualitative disease, it is so bothersome it can affect your life as well.
Right.
And to live long, you have to live healthy enough, but you have to appreciate life for what it is.
On that note, Doc, it was a pleasure and an honor having you in the studio. Dr. Rajendran Sundaralingam, consultant urologist and urological surgeon from KPJ Damansara Specialist Hospital. It's a pleasure to have you in the studio. Stay with us. We're going to come back with more for you right here on Medical Today.
What you put into your body today will shape your life tomorrow. So be sure of good health with Blackmores. Begin better every day with Blackmores.
Hello and welcome back to episode 11, season 3.0 of Medical Today with me, Jared Ratnam. We talked about a very interesting subject, which is supplements. Emily Chai from Blackmores Malaysia joined us. We also spoke to a urologist and a urological surgeon, Dr. Rajendran, who had a lot of information for us on the show. But for now, we'll bring you a video in season 3.0. What we do on a weekly basis is bring you a video on first aid mistakes. And today, we want to look at using antiseptic solutions. Every time you have a cut, or if someone at home has a cut, we turn to an antiseptic solution. Are we doing the right thing? Now that's the question. Here's a video. Let's take a look at how we can better use an antiseptic solution. Let's take a look at it.
The mistake is disinfecting wounds with an antiseptic solution. A lot of us have learned to clean our cuts and scrapes with rubbing alcohol, hydrogen peroxide, or iodine. But those antiseptic solutions can hurt your healing time. We all know the bubbles we see with hydrogen peroxide, but contrary to popular belief, those are your body's skin cells that help promote healing, and the sting from alcohol is your healthy tissue being harmed. Well, do this instead. To get debris and bacteria out, it's best to hold the wound under the tap and wash thoroughly. If it continues to bleed, apply direct pressure until it stops. According to Best Medicine by Renowned Health, once the cut is clean, you can apply an ointment like Neosporin on it for protection. Ideally, let the cut air out or cover with a loose bandage.
Well, there you have it, a video as to how you can use an antiseptic solution or clean a wound the right way. Now, in all times or at all times, with regards to an emergency, if you're lost or don't know what to do, please call 999 and ask for assistance. As cliche or as simple as it sounds, it's the best way forward in times of an emergency. Now, we'd like to once again thank Blackmore's. We also like to thank our friends from KPJ, especially KPJ Damansara Specialist Hospital, for joining us on today's show. Next week, we will be speaking to Dr. Harun Ahmad, a consultant surgeon from KPJ Damansara Specialist Hospital. He'll be talking about bariatric and advanced laparoscopic surgery for advanced surgery and advanced weight gain. So that's a little something we're going to be looking at right here on next week's episode of Medical Today. With that, I'm Jared Ratnam signing off. I hope you enjoyed yourselves watching today's show. Stay with us. Of course, we'll be having more for you right here on Bernama. Once again, we'll be back next week with more on Medical Day. Bye-bye for now and take care.